I am honored to join you for this momentous occasion for the Uhai Wamama na Mtoto Project National Obstetrics Point of Care Ultrasound Guidelines, O-POCUS. Okay. These guidelines were developed to complement the government's efforts in improving antenatal care to reduce maternal and neonatal morbidity and mortality. They enable nurses, midwives, and clinical officers and other reproductive health professionals to share tasks for obstetrical ultrasound screening in accordance with World Health Organization guidelines. This initiative bridges a critical gap in public health dispensaries and centers where pregnant mothers miss out on early ultrasound scans due to a shortage of sonographers, radiologists, and gynecologists obstetricians. These facilities are usually manned by nurses, midwives, and clinical officers who are not trained to carry out ultrasound screening. Moreover, the facilities are not equipped with ultrasound machines as they are expensive and are not part of the essential package for public health centers. Advancement and innovation in ultrasound procedures through the use of handheld screening devices will facilitate high-impact interventions to pregnant women across all counties and regions. It is refreshing to note that these guidelines were developed through the collaboration between the government and key stakeholders represented here, funding from the Bill and Melinda Gates Foundation enabled Ushiriki Wema to lead a high-level and technical advocacy working closely with the International Center for Reproductive Health. Through this initiative, the partners and stakeholders involved are contributing to Kenya's efforts to improve maternal and child health outcomes. We must work together to reduce the high and unacceptable number of women who die from pregnancy and childbirth complications, which places Kenya fourth among African countries with the highest maternal mortality burden. Now that we have the guidelines, I urge the Ministry of Health to expedite their launch and implementation to ensure that our women reap the benefits of this initiative. The users need to be trained on how to use the guidelines, hence the need to develop a simple but effective training and mentoring program that can quickly be deployed to all clinics and centers. A robust sensitization and dissemination campaign is necessary to reach all the beneficiaries and ensure that they embrace the POCUS screening devices. Pregnant mothers have to be aware of when and where the ultrasound scan services will be available in their neighborhoods. We also need to address the other challenges identified during the stakeholder engagement process. These include lack of ultrasound equipment in local clinics, the cost of such equipment, and support infrastructure, including electricity and internet connectivity. Further, we need a comprehensive policy and regulatory framework for the POCUS accreditation and quality assurance to facilitate effective uptake and utilization. Ladies and gentlemen, let me once again applaud you all for this transformative initiative that will certainly improve the livelihoods of our people and build a healthy nation. I wish you every success in the implementation of the point of care ultrasound guidelines. Thank you. I just want to say pongezi sana to all of you for this collaboration. It's very, very important. And we need to have more of this kind so that we can accelerate the process of helping our people access critical health services. And I just want to encourage you to be very, very proactive and powerful in your communication. We have a new era where the social media comes into play. And one of the most dangerous areas, if there's miscommunication, would be in the health sector. So it is absolutely important that we really get our messaging right, because it can be a matter of life and death for our citizens. So I just want to encourage you that after this, the post launch and how you manage it and how you communicate is going to be very, very critical to everybody. Thank you, God bless you, and well done. Thank you. Thank you.
Morning, sir. Very well, sir. Excellency.